Hello guys, today is the third part of the last minute express revision 50 questions from the subject of pediatrics. Harrison's groove is seen in rickets. Okay, here you can see the Harrison's groove below the ribs. This is seen in rickets. Retrolental fibroplasia, now called as retinopathy of prematurity. This is because of radical injury, oxygen radical injury to the retina due to hyperoxygenemia. Coronary artery dilatation is seen in Kawasaki disease. Okay, coronary artery dilatation is seen in Kawasaki disease and the treatment is IVIG. Okay, triad of rash, thrombocytopenia and recurrent infections is seen in Wiskott-Ulrich syndrome. Okay, rash, thrombocytopenia and recurrent infections, Wiskott-Ulrich syndrome. Desire to ingest unusual substances like ice. This is a specific type of pica, okay, and is called pagophagia. Bite cells are seen in G6PD deficiency. Here you can see hemisphere like loss of RBCs. This is seen in G6PD deficiency and these are called bite cells. Schistocytes or broken lysed RBCs in the form of these triangles. This kind of broken RBCs are seen in hemolytic uremic syndrome. Okay, HUS. Schistocytes are seen in HUS. First hemoglobin to appear in the fetus is HB Gower 1. Okay, HB Gower 1, and this occurs only in the embryonic period of the fetal period. Metachromatic leukodystrophy is because of aryl sulfatase A deficiency. This enzyme is deficient, aryl sulfatase A deficiency. Adrenoleukodystrophy, the gene mutation is ABCD1. Adrenoleukodystrophy, ABCD1 gene mutation. Treatment of multiple carboxylase deficiency is biotin replacement. Most common enzyme deficiency in galactosemia is galactose 1-phosphate uridyl transferase. This is the most common enzyme that is deficient in galactosemia. Here in this picture you are seeing tuberous sclerosis lesions. One is shagreen patches, this leather like patch, this is shagreen patch, and ash leaf macules over here, hypopigmented macules. These two lesions are seen in tuberous sclerosis. Trigonocephaly, this is because of premature closure of the metopic suture. Chorioathetosis, these abnormal movements of chorea and athetosis are seen in extrapyramidal type of cerebral palsy. Basal exudates are seen typically in tuberculous meningitis. Complication of H. influenzae meningitis is sensory neural hearing loss, sensory neural deafness. MCU finding in posterior urethral valves is dilated posterior urethra. This is a spotter. This is an image based question. Here you can see the dilated posterior urethra, and this is seen in the condition of PUV. Toxic megacolon is seen in chronic ulcerative colitis. Recurrent chest infections and exocrine pancreatic insufficiency. This is seen in association with cystic fibrosis. Recurrent chest infections and exocrine pancreatic insufficiency seen in cystic fibrosis. Myxomas, these are benign tumors of the heart and most common location is left atrium. These are benign tumors of the heart and left atrium is the common site. Most common cause of native valve endocarditis is Staphylococcus aureus. Migratory polyarthritis that shows dramatic response to salicylates. This is seen in rheumatic fever. Okay, migratory polyarthritis, rheumatic fever. P. pulmonale, over here you can see a peaked P wave that is taller than 2.5 millimeter. Okay, in the limb leads. This indicates P. pulmonale and this is seen in tetralogy of Fallot. P. pulmonale is a feature of tetralogy of Fallot. Aortic root dilatation is classically seen in Marfan syndrome. Phototherapy lights, the most absorbed light wavelength is 450 to 460 nanometer, although the range is 430 to 490 nanometer. This is the range, but 450 to 460 is most absorbed. LS ratio or lecithin sphingomyelin ratio in the amniotic fluid of more than 2, it indicates adequate lung maturity, and it is utilized for the prenatal diagnosis of hyaline membrane disease or respiratory distress syndrome. Pectus carinatum or pigeon chest is seen in rickets. Pigeon chest, pectus carinatum is seen in rickets. Most common inherited cause of mental retardation or intellectual disability is Fragile X syndrome. Most common inherited cause is Fragile X syndrome. First, secondary or permanent tooth to erupt is the first molar. First permanent tooth to erupt is first molar. Nocturnal enuresis, the drug of choice is desmopressin. Okay, desmopressin and imipramine, but the most appropriate answer will be desmopressin. Prader-Willi syndrome, there is increased food intake or increased hunger, hyperphagia and obesity because of elevated ghrelin levels. Post-diphtheritic paralysis is usually seen in 3rd and 4th week of the infection, and palatal and pupillary paralysis is characteristic. Okay, palatal and pupillary, and this is a reversible condition. Okay, usually occurs in 3rd or 4th week of the infection. Most common symptom of tetanus is trismus, that is difficulty in opening the mouth or restricted opening of the mouth. Now VDPV, that is vaccine derived poliovirus, and VAPP, vaccine associated paralytic poliomyelitis, these occur in poliovirus type 2 due to poliovirus type 2. Okay, VDPV and VAPP, and these are usually side effects or serious side effects of the oral polio vaccine. These are usually the side effect of oral polio vaccine, and these do not occur with injectable polio vaccine. Saber shin, this in the picture you can see anterior bowing of tibia over here. Okay, and this is seen in congenital syphilis. Saber shin, this is a sword like curvature, that's why it's called saber, and this is seen in congenital syphilis. Downy cell, these are atypical lymphocytes, and these are seen in infectious mononucleosis. Okay, atypical lymphocytes that are seen in infectious mononucleosis. Downy cell. Loeffler syndrome is caused by pulmonary ascariasis, basically eosinophilia and worm infestation. Okay, not just ascariasis, it can also occur with hookworm, that is Necator americanus, etc., but it's more commonly associated with pulmonary ascariasis. Williams syndrome is associated with supravalvular aortic stenosis. The active form of vitamin D3 is 1,25-dihydroxycholecalciferol. Omphalocele is usually nearly 43% of omphalocele are associated with chromosomal anomalies. Most common complication of mumps is orchitis, and basophilic stippling is seen in lead poisoning. You can see the RBC having these purplish bluish purple spots. Okay, this is basophilic stippling, and this is seen in lead poisoning. Giant cell pneumonia or hex pneumonia is seen as a complication of measles, okay, in severe forms, and it's usually seen in immunocompromised host. Bone within bone appearance is seen in osteopetrosis, like what you can see over here, and it's also called as marble bone disease. Okay, marble bone disease, and this is bone within bone appearance. Botulism is caused by Clostridium botulinum. The botulinum toxin causes botulism, and this toxin causes the infant to be floppy. Kallmann syndrome is hypogonadotropic hypogonadism and is associated with anosmia. So if you see anosmia and this Kallmann syndrome, this anosmia is the answer. It's basically because of the agenesis or hypoplasia of the olfactory bulb. Kostmann syndrome, it is due to defect in receptor of the GCSF on neutrophils. Okay, the granulocyte colony stimulating factor, it attaches to the neutrophils with the help of this receptor. There is a defect in this receptor in case of Kostmann syndrome. Increased osmotic fragility is seen in hereditary spherocytosis. Okay, increased osmotic fragility of RBCs is seen in hereditary spherocytosis. Burback granules in the cytoplasm are seen in Langerhans cell histiocytosis or histiocytosis X, as it is also called. You can see here the tennis shaped racket. Okay, this is seen in the cytoplasm of the dendritic cells in the skin and mucosa. Okay, and this particular lesion is called Burbeck granules. And this is over here you are seeing the electron microscopy picture of this Burbeck granules. So this is seen in LCH or histiocytosis X. So that's all for today guys. Stay tuned for the next video. Happy studying.